So we're going to go ahead and get started. Thanks so much to all of you for being here today and welcome to our webinar. I'm Elena Marks, a senior fellow in health policy at Rice University's Baker Institute for Public Policy. For the next 90 minutes, we'll be talking about what's at stake for Texans who buy their health insurance through the Affordable Care Act's marketplace. Today, there are 4 million Texans, about 12% of our population, who get their coverage through the marketplace. And 3.4 million of those depend on premium tax credits to enable them to buy affordable coverage. These tax credits for low and moderate income families have been in place since the marketplace opened in 2014. But in 2021, Congress increased the amount of the tax credits, which made more plans more affordable for more Texas families. The impact of the enhanced tax credits is plain to see in the enrollment numbers. As you can see on this chart, we went from about a little over 1 million people in 2020 to 4 million people covered today. But these enhanced tax credits are set to expire at the end of 2025 unless Congress takes action. Today, you'll hear from 6 experts, each of whom will address the potential consequences for our state if Congress doesn't act. First, you'll hear from Tom Banning. He's the CEO of the Texas Academy of Family Physicians. He'll explain the impact on physicians and particularly primary care of these enhanced tax credits. Next, you'll hear from John Hawkins, the CEO of the Texas Hospital Association. And he'll talk about how this issue impacts access to hospital care for all of us. Then you'll hear from Jamie Dudensing, the CEO of the Texas Association of Health Plans, and she'll explain how tax credits affect the insurance market and premium costs. Then you'll hear from Dr. Esmail Porsa, whose day job is serving as the CEO of the Harris Health System, but he's with us today to talk about the impact on business, including the healthcare business, because he serves as the chair of the Greater Houston Partnerships Health Committee. Then you'll hear from Stacy Pogue, who's a senior research fellow at Georgetown. Stacy is going to talk about the importance of the enhanced tax credits to the 3.4 million Texans who depend on them. And finally, you'll hear from Ken Yonda, a principal at Wild Blue Health Solutions, who'll tie it all together. And then we want to hear from you. And we want to be able to take your questions. So throughout this webinar, assuming the chat is now working, we would ask that you put your questions into the chat. If for some reason we can't get the chat working, then you're going to need to write your questions down and you'll be able to raise your hand at the end and we'll call on you for the questions. We'll keep track of whatever comes into the chat, assuming the chat's working. And we're recording this webinar and it'll be available later for you to review and to share by going to the events page of the Baker Institute website. Again, thanks for being here today. And now let's get started and I will turn it over to Tom Banning.
Thank you, Elena, and thank everybody for joining us this afternoon. My name's Tom Banning. I'm the CEO of the Texas Academy of Family Physicians. We have about 9,000 members throughout the state, from the Panhandle to the Valley, from El Paso to Beaumont, and everywhere in between. And if you think about a family doctor, it's the first entryway into the healthcare system. So, it's your family physician, it's your general internist, it's your pediatrician. And those specialties also tend to distribute themselves demographically or geographically like the state. So when you think about physicians that are serving in rural communities, those are largely family doctors and other primary care doctors. So when we think about healthcare and health insurance in particular, we believe it's a public good, much like education or clean drinking water. We want individuals to be healthy. We want them to be healthy so they can work and learn and thrive in society. But as all of you know, I don't have to explain this, healthcare is very expensive. And health insurance is a hedge against potential bankruptcy that patients could face if they fall ill for some reason. Healthcare is kind of a unique market in terms of patients don't choose to get sick, but they do. It happens. It's part of life. And how you pay for that and protect yourself is critically important. So, the initiatives with the subsidies for this insurance products that we're talking about today have been a lifeline to literally millions of Texans across the state. And our concern, if this was to go away, number one, you would likely see continued or even more consolidation that's occurring right now in the marketplace. From a business standpoint, taking on more cost for providing care for the uninsured. Physicians' finances, certainly primary care physicians' finances, are challenging at best when you see a continued cuts or freezes in Medicare payments and Medicaid payments and a flattening in commercial payments. Running and operating a business is very challenging in that environment. If you take out a portion of your insured population, running that business makes it even more difficult. So what, there's the business aspect of physicians practicing would be challenged. We'd also have, I believe, a greater maldistribution of physicians going into rural and underserved communities, because those areas tend to have a higher percentage of Medicare, Medicaid, and the insurance exchange products just based on their employee demographics, small businesses, which I know some of the other panelists are going to talk about. And what that ultimately results in is a greater shift in cost to employers who are paying the bill, and they're already paying exorbitant fees for that insurance. So what our hope is, or what our desire is that we find ways to keep the cost of health insurance low, which these strategies, subsidized strategies, provide, so people don't have financial concerns about going in and getting cared for and having their problems addressed on the front end before they become more acute and more costly and need hospitalization or specialty care. And these exchange products and plans have created the opportunity for individuals to access the healthcare system that they would have otherwise been shut out from. So I will stop there, Elena, and kick it over to John, I believe.
Thanks, Tom. And before you get started, John, let me tell everybody who's listening, the chat's not open, but Q&A is. So please put in any questions you want to the Q&A, and we'll take care of them all at the end. Excuse me. Go ahead, John.
No problem. And thank you again for joining us today. John Hawkins, I'm President and CEO of Texas Hospital Association. We represent about 600 hospitals across the state. Those are government entities like Harris Health there, Dr. Porce's Hospital, investor-owned, and the not-for-profit sector as well. Urban and rural hospitals. So as Tom detailed, losing this coverage, I think ultimately impacts access to care. And from a hospital perspective, when we lose those medical homes out in the community, particularly in rural areas, that care is still going to be provided based on community expectations and federal law. And it just means more uncompensated care for providers, which, as Tom mentioned, gets shifted on to local taxpayers and or the private market. And so we know, providers already struggle with an uncompensated care burden, particularly in the primary care space and in the rural space, that often, unfortunately, ends up with us losing those access points. And we know, just looking at research we've done as to prepare for the impact of this, that hospitals, physicians, and providers across the board would face billions of dollars in uncompensated care and lost revenue. And that's hospital services, it's office-based physician services, other healthcare services, and prescription drugs. And the data, shows, particularly in rural areas, even Texas-specific data, uncompensated care will drive down hospital revenue by 6.3% in Harlingen, 5.8% in Abilene, 5.5% in Wichita Falls. And so you can see that's added cost on what is already a fragile safety net. And we know in Texas, for example, as Tom mentioned, Medicare doesn't pay the actual cost of services. For hospital care, it's about 82% of cost. Medicaid base rates pay about 72% of inpatient cost, about 75% of outpatient cost. And then just the burden of the uninsured. Texas, unfortunately, still leads the nation in the number of uninsured. That generates about 8.8 billion in uninsured and charity care costs for Texas hospitals, and that's reported to the state, and that's at cost. We do offset that, thankfully, with about 5.1 billion in supplemental payments, although that's a discussion we're having right now in Washington about potential cuts to those payments. So that still leaves 3.7 billion in unreimbursed, uncompensated care that gets shifted elsewhere in the market. And so our concern is losing these tax credits would just add to that number. And from a hospital perspective, folks being able to access this market-based coverage, a very stable insurance product, is very beneficial in the market, and I think has broader ramifications for the risk pool generally, which I know other panelists will talk about. So I will stop there and kick it to Jamie.
Hi, good afternoon. As mentioned, I'm Jamie with the health plans. And one of the, there are a few things we've really learned over the last 4 or 5 years, watching such a huge increase in the market and the number of people purchasing coverage with the help of these tax credits. And that's one, Texans want health insurance coverage, and that makes sense. Healthcare is really expensive. Say you're a pregnant mom and you have a baby and you end up in the NICU, the average cost of a NICU stay is $77,000. No one has that. The average cost of a brand new drug coming on the market, some of these life-saving drugs, is $300,000. Heart surgery easily costs $200,000. And these are things you never want to have happen, but they are things that do happen and that people really cannot afford if they don't have health coverage. So we know Texans want health coverage. The next thing we've really learned is that most of the working uninsured in Texas work for small employers. And we have a large number of small employers in Texas, and only 27% of small employers offer coverage. So that means that those Texans have no other choice but to buy this coverage on their own. And as John was mentioning, it can be really expensive. So really the third thing is, and that we have really learned, is that when you make health insurance more affordable, and with this solution, tax credits, people will buy it. And we have seen that over the last 4 years. From 2020 to now, we've seen 1 million Texans purchasing health insurance in the individual market go to 4 million. That's unheard of. We've stayed at 1 million for the 10 years before that. And just with this help from the tax credits, we grew to 4 million Texans. And it just shows that when it's affordable, they will buy it, they want it and need it, and it finally hits at a price point where they can really purchase it. So it makes a huge difference. And, I'm gonna hit on a few other points that were said already. The other thing we saw on people purchasing it is now you had more plans in the market. You created a more stable market, more competition. More counties in Texas have 3 or more plans participating, which lowers prices for health insurance, creates more competition, and gives Texans more choice. So you're also seeing, a much more competitive, robust insurance market for these individuals, which is all a big win for the state of Texas on this. And when we really talk about the cost of coverage with these tax credits, you're talking about the average cost for, especially for some of, like those more low-income working Texans being, for each individual in their family, being around $50 a month. That makes a difference. And we're talking about the cost of these premiums more than doubling for most Texans if they lose these tax credits. And as all of you know, we all talk about the prices of eggs, we talk about inflation, all of these pieces. This is not something that working lower income and working Texans can absorb right now, is doubling, tripling, and quadrupling the cost of their health insurance coverage. They have to give up something when they're making these choices, when you have so many prices increasing and so much pressure on them and their families and their pocketbooks. So it makes a huge difference to make health insurance affordable for them. It changes the lives of their families. It helps give them the protection they need, really the protection they need when something, tough happens in their family, whether it's something bad or a health incident, so that they have the comfort they need. And in return, helps ensure that we've got our providers, like our hospitals with John Hopkins and our doctors with Tom Banning, to make sure that when these individuals see them, they're actually getting paid for the services that they're providing. So all of this is really important for making sure people have coverage, making sure people get the care that they need, and making sure we still have the providers we need in Texas to provide that care. And I'm happy to pass it off to the next speaker.
All right, and I think that's me. Thank you for that. All right. As Mark Porter, President and CEO of Harris Health, just very quickly about Harris Health, we are one of the largest safety net hospitals systems in the country. We 2 hospitals, Bentop, level 1, trauma, LPG level 3, 40 other locations across Harris County, mostly focusing on the high socioeconomic needs areas of the county. We are definitely focused on community health. Always emphasize the fact that if you put both of our hospitals together, we have about maybe 45,000 discharges, inpatients, and the outpatient setting. Last year, we had 1.6 million patient encounters. So definitely community oriented. I'm going to try to paint a picture of how this issue that we were talking about, the potential elimination of the preferred tax credits, is not just an issue for the indigent. It's something that is really going to impact all of us, those who have insurance at all levels, but also the economic impact to Texas. You already heard that 3.5 million Texans rely on this preferred tax credit, and everybody knows that if this were to go away, the likelihood is about 1 million people are not going to be able to afford health insurance anymore. And the reason for that, you just heard, is because the increased cost, the expected increase in the cost of premiums. I have a couple of examples here. There are many of them. The 40-year-old man earning $40,000 a year, which is about 265% federal poverty level. That person's premium would increase from about $1,716 a year to almost double that number, $3,384 a year. A family of 4 with an income of about $90,000, that's 280% federal poverty level. For a family of 4, their premium would go up from $564 to $4,116, almost a 640% increase. Like you heard already, these are not tenable for the average person who relies on premium tax credits through the marketplace exchange. The state of Texas is a small business state. And this is something I learned recently looking into this. 99.8% of the businesses in Texas qualify as a small business. These are businesses with less than 500 employees. 90% of the businesses in Texas have less than 20 employees. And you already heard that only 27% of businesses provide employer health insurance. So majority of the folks in Texas, in our businesses, are relying on this preferred tax credit to afford health insurance. If this were to go away, you already heard that we anticipate out of the 1 million people becoming uninsured, and we already unfortunately know that Texas ranks first, last, depending on how you look at it. and the percentage and the number of uninsured. When we have more uninsured people, and you already heard from Dr. Bannon, they're going to have to receive care somewhere. I can tell you there is no room in the inn in our safety net hospitals. Harris Health, we're already over capacity. These additional uninsured people have to receive care somewhere, and that somewhere is all the emergency rooms in our areas. And I can tell you all the emergencies right now are inundated with patients. So a couple of things will happen. Access to emergency care for everybody is going to be impacted negatively. That's you and I and everybody else. But also cost of care for everybody would go up because emergency room care is very, very expensive. Hospitals are not going to just absorb that cost. They're going to pass that on to the insurers. Insurers are not going to swallow that cost. They're going to pass it on to their consumers. Their consumers is everybody in this call. Everybody with health insurance. So actually the cost of care for everybody would go up in the form of additional out-of-pocket deductibles and also higher premiums. So this issue is going to be one that is going to impact everybody. You know, going back to the economy of this, I read that termination of the tax credits in Texas, and why Texas specifically? Again, everybody knows Texas is a non-Medicaid expansion state. Lots of uninsured people, lots of people rely on the Affordable Care Act to have health insurance. In Texas alone, it's anticipated that if this were to go away, 70,000 people would actually lose their jobs. That's in the healthcare sector and outside of the healthcare sector, with a $14 billion negative economic impact on the state of Texas. So these are all very real. As far as the job losses, just mentioned that, but also almost $400 million negative impact on the ability of the state to collect state and local taxes. Huge issue. It's crazy to me that we actually have to talk about why this is so important and existential to the economy of the state of Texas, but also to the health of the people who live in Texas. A prosperous Texas is a healthy Texas. So let me stop there, and at the end, I'm happy to answer any questions you all may have.
Thanks very much. Let's move over to Stacy.
All right. Hi, I'm Stacy Pogue. I'm really grateful to be here. I work at Georgetown University in a group that does research on health coverage and healthcare access from a consumer perspective, but I'm based here in Texas, and I've worked around healthcare advocates and patient groups for a long time. My focus today is to talk about the people of Texas, the Texans who are going to be hit in their pocketbooks and some who will be unable to afford the coverage they currently have if Congress fails to act to extend enhanced tax credits this year. So first, though, I think it's important to say why the marketplace plays an outsized role in how Texans get coverage. More than 1 in 10 Texans have coverage through the marketplace. And that's because lots of jobs in Texas don't come with an offer of employer-sponsored insurance. And this is not new. It's long been the case that we have people who work full-time, year-round, doing hard work in low-wage jobs that doesn't come with benefits. It's daycare workers, dental assistants, people who work in hotels, people who work in restaurants. They're not offered job-based coverage. But it's also folks in middle class and middle income and even higher income brackets who work for certain employers who can't offer coverage, particularly, as Jamie mentioned, small businesses. Small businesses are unlikely to offer coverage, so the marketplace is a lifeline for small businesses, their employees and their owners, and entrepreneurs and self-employed individuals. Another reason, and a big one, that the marketplace is important to Texans is because Texas has opted not to expand Medicaid for low-wage adults. And most people who would be able to qualify for Medicaid if Texas expanded it are locked out of the marketplace. But there's a subset who can move to the marketplace instead. And that's one reason the marketplace is so much more critical here in Texas. And the other thing, and Jamie mentioned this, is that Texas has had phenomenal growth in the marketplace. It's the highest enrollment growth rate in the nation since 2020, since the enhanced tax credits became available here in Texas. And so for all of those reasons, inaction by Congress is going to hurt people in Texas. It's going to hurt Texans more than folks in other states. The Affordable Care Act does not do everything well, but one place where it excels is a marketplace coverage. It offers coverage to people who don't get coverage through their jobs, and we've talked about them. But also, some people don't use marketplace coverage year in and year out, around, year round. Some people get it for just a gap, just for a short period of time. So when you have a baby and you want to cut back to part-time to take care of your infant, or you cut back your hours at work so you can go to school and get a degree and get a better paying job, or you get a new job, right? And you're just waiting for your new job, your new employer's coverage to kick in. But another place that's really important is in economic downturns, right? When we have a recession, when there's big job losses, marketplace coverage is available to Texans. It's affordable and available, and those tax credits make a big difference. So if the enhanced tax credits expire, premiums will shoot up for all of these types of Texans who depend on it. That'll start, they'll be hit in their pocketbook in January 2026. The monthly bill they get for health insurance, the premiums go up. And it's going to hit middle-class families hard. Middle-class families are struggling now to afford gas, to afford groceries, to afford housing, and a lot of worried about kind of big economic forces that are in flux, and how does that affect their job? How does that affect their groceries? And another pocketbook expense that doubles or triples is going to be something some folks just can't absorb, right? And it means they're going to be priced out of their coverage. The people who will be hit hardest, though, are in unique groups. So the average premium in Texas, if these enhanced credits go away, will double, more than double. Texas is one of the handful of states where premiums will more than double. But some people get hit harder because that average kind of masks a lot of variability. And that's Texans in rural areas. Rural Texans usually pay more for health insurance, the underlying premiums. Texans age 50 to 64, who are going to have the highest dollar value increase, particularly in middle incomes. People who have low-wage jobs, their kids might be on Medicaid or CHIP, but the parents are in the marketplace and they'll see the biggest percentage increases. People with chronic conditions, cancer, diabetes, who depend on the healthcare system and just don't have the luxury of having a gap year with no coverage and waiting to see what Congress does next year. And of course, as we've said, small business owners, their employees, self-insured individuals, they comprise a really notable share of marketplace enrollees. So I just want to leave you with one story of one real Texan who depends on these enhanced tax credits for coverage. This is a story from every Texan, and I am grateful to them for sharing it. It's of Gary. He's 56. He lives in Central Texas. He's married. He has one kid in college, and he owns a business. He's a roofer. He owns a roofing company. And for his whole life, he's been a roofer. He's always worked for small businesses. They've never provided insurance, right? So he's been uninsured. And when he started his own roofing company, he looked at insurance. He wanted to offer it. He thought it was risky, right? Risky work to be doing to not have insurance, but he just didn't have the money. And in the early days of the marketplace, he checked it out, and he found out it would cost him $1,500 a month to get him covered, him and his wife and his child covered. But they didn't have the money. They're trying to save for college. They're trying to run a business. So he went uninsured and did it for years. He'd take his kid in for checkups. But other than that, the plan between Gary and his wife was just to go to the ER in an emergency and just cross their fingers that the bill wouldn't bankrupt them, right? And they lost sleep. They were worried about this plan, right? Because it could end in financial catastrophe for them. But he looks back and he feels like he was lucky that nothing happened in those years. And then recently, an employee of him told him about the marketplace. And he said, yeah, I looked. I can't afford that. And that employee said, no, go back and look again. It's more affordable now. So he went to a navigator. And those are the nonprofit community-based groups that help people enroll. And the navigator showed him that the lowest cost coverage available to him now was $200 a month. That wasn't the right one for his family. He wanted something that had lower out-of-pocket costs. So he picked one that's $400 a month. And he gets to go to physical therapy. He got his blood work checked. He said he never would have done that without coverage. His wife kept their doctor. And he said he thought it wouldn't work. It would be too expensive. It wouldn't be easy. And none of that's how it played out, right? But he also knows that if his bill, his monthly premium bill that comes comes in the mail, if it goes up from $400 a month to $1,500 a month, he's going to have to drop coverage, right? He can't afford that and have a kid in college and grow his business. So Gary and his wife and his kid, that's just 3 Texans out of 4 million who depend on the marketplace, who sleep better at night because they have coverage, and who are going to pay much more affordable rates because there's enhanced tax credits today But those folks are all at risk of losing coverage if Congress doesn't act to extend them. I'm going to hand it back either to Ken or Elena.
I think it's me, and I'm trying to share my screen here. Back. Is it back on?
There we go. Yes.
Yes. Yeah. Thanks everyone who's already commented, and I have the challenge of going last because most of my points have been covered. But a couple of things I wanted to build on that have already been said, and just to remind people, this is the curve that Elena mentioned at the very beginning, and this is 3.5 million in 2024, and now it's up to 4 million people in 2025. But I want to also remind people about this curve before 2014, which is that there were only about 200,000 people with individual policies, and those individual policies prior to the Affordable Care Act were medically underwritten so that we could go around as a recovering insurance executive was actually part of doing this, of sort of saying, okay, we'll cover you because you're young and healthy. We won't cover you because you have a pre-existing condition. You will charge a much higher rate because we've done a medical underwriting type stuff. And so the market was really dysfunctional prior to 2014. The fact that the ACA brought in no pre-existing conditions, guaranteed issue, guarantee that there would not be an annual maximum or a lifetime maximum, that preventive services would be covered and stuff, really started helping a whole lot. And as I said before, we sort of ran about 1 million a year until the enhanced subsidies came into place. And then it's really jumped from 1.2 million to 4 million in just this period of time, which really says how much people appreciate the coverage. What that has also done is very much stabilize the risk pool. So insurance, is pooling of everybody's funds together, and then those people who have high claims, it gets paid. And so one of the things that these enhanced subsidies have actually really done for the market is to really make it work very well, and the rate increases have been really quite small the last 5 years in Texas, in the 1-3% range each year, which is much better than health insurance has been. So taking out this coverage or the enhanced subsidies really is potentially raises rates for everyone, as Stacy and some of the other folks have done. So I think it's really important to think about it at that macro level. Another kind of macro level to think about this is that this is a statewide problem, as some of the speakers have said. If you look at the map here, this is, virtually, Elena said 12% of the total population of Texas has these policies now. And almost these are congressional districts, the federal congressional districts, which shows that almost everywhere it's pretty significant. So there's no congressional district in Texas that has less than 70,000 people getting these subsidies, and some of them are as much as 150,000 people. I live in a pretty affluent district, I'll admit it, in Fort Bend County, and there's 122,000 people in congressional district, is it 28, that I live in Fort Bend County. It's a big percentage of the population. So it is a statewide issue, and it is a U.S. congressional issue. I saw one of the questions in the chat that I just wanted to hit on real quick, is it's not really something that the Texas legislature can do something about, because these are federal subsidies, and that's why the activity is actually with Congress, and why we're sort of showing this by congressional district. But it's a big issue. Another way that I think about it on a macro level is that Texas gets, it's about $1.5 billion a year in enhanced subsidies, which go to pay claims to doctors and hospitals and pharmacies and those things. So it's really an important part of, as other speakers have talked about, sort of this lifeline of additional coverage. You know, Texas has more uninsured people than any other state, and both on a raw number and on a percentage. And it's really been these the individual coverage under the ACA that has driven the reduction in uninsured that we've seen in Texas. Not as much as other states, but we are doing a little bit better. And so we hate to go backward on that, as other people have talked about. But I really appreciate Stacy's comments probably the most, because it's the individual people that this is a lifeline for. And I think about it, and I know it's kind of wonky, and most of you listening probably have not studied the exact way the subsidies are calculated and stuff like that. But I think, as Dr. Porter said, you take somebody that's making $60,000 a year, well, great, they're doing okay. And yet, if you look at what their insurance premium would be for themselves and their family, it could very well be 25, 30% of their salary. I mean, that's the reality of how much health care costs are these days. And so if they work for a large employer, they get a subsidy. If they work for state government or county government or the federal government, they're getting large employer subsidy. If they're very low income, some of them may get a subsidy in the form of Medicaid premium, or if they're over 65, Medicare. And so it's really these folks that have to pay for their own insurance premium that have been sort of caught out in the cold the whole time. And so these subsidies have actually been really remarkably successful in helping people get coverage and stay covered. And so, the bottom line is we need them to continue. One of the other things I just wanted to reinforce real quick before we open it up for questions is that as I think it was Jamie said, there's a lot of small businesses that just can't afford to provide health insurance for their employees, new startup companies. What we've actually found is not just that the subsidies under the Affordable Care Act for individual policies work, but there's also a growing number of small businesses that actually are contributing money so that people can go and buy a policy themselves. And so having a stable risk pool for those people as well really is a very important part of what we need to do. So when I kind of look at all this, I think, okay, obviously this is a really good thing for the individuals who are covered. It's a good thing for hospitals. It's a good thing for doctors. It's a good thing for small employers. One other group that Stacy mentioned that I think is really important too is it is a great thing for pre-65 retirees who are able to not have to stay on their employer-sponsored insurance if they want to retire early and stuff, because they're able to also buy an individual policy. So I look at this and I compare it to all the other subsidies that we get for healthcare, and it really seems to me to make a lot of good sense that we continue those. And so that's why we're kind of here today, is to make sure that all of you on the webinar are thinking about this and recognizing that if Congress does not act, these enhanced subsidies go away December 31st of this year, and people will have a real shock to how much they're going to have to pay. But it's not till December 31st that they go away, but the insurance companies have got to submit rates and get them approved by the state and the feds between now and then. And so they've got to act really by May or June to extend these, because it changes what insurance companies' rating strategies will be if they think that 1 million people or so could lose coverage. So all that said, I know some of that's kind of wonky, but for all these reasons, I'm really hoping that we can help encourage our congressmen to keep these in place.
Thanks very much. Thanks to all of you. This was a ton of information. I'm going to start with a couple of practical questions and then work in questions that people have submitted. If you didn't submit one in writing and you want to ask a question, use the raise your hand feature or type something in. Ken, you talked a little bit at the very end about how do we, what is the timing and what is it that we can do if we believe these credits should be extended, the enhancements. What can people do about it? And this is not just a question for Ken. What is the timing? Jamie, you may have better insights onto the timing representing the health plans who have to propose their rates. And what is it that those who are on this webinar can do now that they've learned this information?
Well, I'll start by just saying you should make sure that your congressman knows that this is an issue and that it's important in his district or her district. You should also let Senator Cornyn and Cruz know as well that this is something that needs to be addressed. And it's a big issue in Texas. It's Texas and Florida are the two biggest states for these subsidies and the number of people that are covered.
Jamie?
Well, to add on what Ken was saying, we have to turn in our premiums or rates way in advance. So June is really where we're at right now for turning that in. Health plans are being told they're going to get a second chance, if the subsidy or the tax credits have still not passed, in August, to make that change. But after August, it'll be too late. And individuals will start, the whole process of the rates being finalized, those premiums being finalized will happen. And then Texans will start getting, those renewal letters that show that their cost of their health insurance coverage is doubling, tripling, quadrupling, and really having the rough decision of letting their family lose health insurance, or, taking really finite dollars that they don't have to really pay for much more expensive insurance. So I would say, and it's all Congress. There's not a whole lot we can do here at the state level. So it really takes congressional action to renew the exact same tax credits that families have gotten for the last few years to make sure they can afford this coverage. And for it to really set and not hurt Texans, it's really the last, I guess, the last time is really August at that second chance.
Thanks. We've got a question. I think you've already answered that this is in Congress's hands, that the state can't do anything about it. But we've also got a question. So if this happens, is there anything either the state or we or families can do to get ready for this? Are there any other alternatives if these premium enhancements go away for the people that we know have been able to buy insurance only because of them?
Other than, this will, that's really your only option for buying health insurance is, through the individual market where people are able to buy that. I'm not expecting, small employers to suddenly start buying health insurance overnight when we haven't seen that in 10, 15 years. So this is really it. They may have to go pay by cash, but as I've mentioned, that's fine if you're going to see your primary care doctor and you could trust that no one in your family is ever going to get sick again, but we all know that's not true, right? So this is really it for real health insurance that's meaningful, that's going to pay for that hospital care, pay for those drugs, pay for that doctor care. And this is really it for lowering those prices for those, lowering that out-of-pocket cost for those families is to have that tax credit available to them.
Yeah, Elena, I was going to say, a crazy idea. We could expand Medicaid and cover some of the folks who are going to lose.
Yeah, it's sort of like, we don't want to expand Medicaid here in Texas, right? Like you keep hearing that. Well, this is the private market, private health insurance is the other option. So, having a robust, affordable private health insurance market, is where families go right now. If you eliminate all of it, there's nothing. it's a good point.
Yeah, I would add there may have, I've seen some articles about states that are potentially game planning a way to backfill this, but I can assure you that is very far from the Texas legislature. And I mean, we're having a hard time getting them to pay attention to potential Medicaid cuts under the reconciliation process, much less look down the road at what this might do. So it really is. I wouldn't expect the state legislature to step in with any state funds to backfill this.
Yeah. One of my concerns is that if it doesn't get extended, there may be some folks that say, oh, well, there are non-ACA compliant products out there that you could buy instead, what I generally refer to as junk insurance, which are some of these policies that you can get that have very severe limitations on what they cover. They also are policies that you can get that do include medical underwriting that you may be denied coverage for. Sometimes referred to as short-term limited duration policies. And I just really worry about those because if you want insurance that's going to make sure that it covers a catastrophic situation, covers prescription drugs, covers maternity, covers mental health services and stuff, you need to have an ACA compliant policy that is assured with these subsidies.
Okay, quick answer to a question from Lynn Cowles about which committee has authority over this. I'm told it's Ways and Means, but reaching out to anybody is always helpful. We've got a question that's not directly on point, Mary Beth, but I'm going to ask it anyway. The reason health insurance is expensive is because the costs of healthcare are expensive. And she's asked a question about would all of us who support the enhanced subsidies also support other cost-cutting measures that are under discussion?
So I'll take that on absolutely. And I think at different points, we all have testified on the absolute necessity to do this. You know, and I read the question. It says, you know, one of the goals was to lower the cost of healthcare. Absolutely, but that was one of the goals. A couple of other goals were to improve the overall health of our communities. I think you can check that box. But really important, and I remember this conversation, was to slow down this crazy thing that was happening in our country where people were being bankrupt because of cost of healthcare. More people in the United States were declaring bankruptcy because of cost of healthcare than any other country in the world. And this has done a great job in reducing some of that. No question, healthcare costs continue to go up. Does that need to be addressed? Absolutely. Does taking this away going to help that? Absolutely not. It's only going to increase the cost of care when people are going to actually be more sick when they present with whatever issue they're having. So yes, we all want to decrease the cost of care. We want to get away from volume-based care to value-based care. But taking this from our patients and our communities is not the answer.
Yeah, Elena, that's a great question. I appreciate whoever asked that question. You know, the way I think about it is sort of like eating an elephant. You know, you take small bites at a time. And when we passed the Affordable Care Act, I think the Obama administration made a political calculation that if they tried to tackle cost at that time, they would lose a substantial number of groups that supported the bill. You know, cost has been of a foremost focus in the Texas legislature this session. And I know that there's going to be some announcements from the administration in the very near term looking at cost. They've been waiting until Dr. Oz has been confirmed. He's confirmed. They've got some work groups that are not very public right now that are going to come out with some fairly comprehensive recommendations on, you know, really bending the cost curve in health. And I think this administration has shown they're not afraid to blow things up and, change the status quo. And sometimes, unfortunately, it takes a crisis for Congress to act. And when you look at the economic damage that's been done with the tariffs and the potential for a downturn, when you've got employers, very large employers, shouting that they can no longer afford to provide the care that they want to or the insurance that they want to for their employees, Congress listens and reacts to that. So I am absolutely certain that in the very near term, we are going to be in a very different conversation around cost. That said, this policy of extending subsidies for the marketplace shouldn't just be thrown out, because it would do terrible damage to institutions, to physicians, to patients. And, we're going to get there, but in terms of addressing costs, but the idea of throwing out a system that's helped so many for the damage that it cause in the short term is just not very good policy.
Thanks. We've got a question in here about ICRA. Somebody want to take that and tell us what ICRA is?
I guess that'll be me, huh? So the ICRA is an individual coverage health reimbursement arrangement, individual coverage health reimbursement arrangement. And this is a program that actually was instituted in the first Trump administration that said that an employer could put aside a certain amount of money per employee per month, that they could then use those funds to go buy an individual policy on the marketplace. And it's really been very widely picked up by new companies that are getting started, especially during the pandemic when people lived all over the whole country. And so you have a small employer that has one person in California and two people in Texas and one person in Kansas. They could each pick an individual plan that made sense in those markets. And those are the same policies. The employees don't, if the employer is contributing money into the ICRA so that the employees can buy the policy, they don't get the enhanced subsidies, but those people are in the risk pool. So some of those 4 million people are actually ICRA people right now, most of the unsubsidized people in Texas. But that stabilizes the risk pool, because these are healthy people who are working and stuff, and that's good for them, for an insurance company, for them to be in the pool. So it's if we lose a lot of the people with subsidies that go away, that potentially makes it more costly for those small employers who've tried to provide health insurance through the ACA. I'm sorry it is kind of complicated, but I hope that made.
Well, somebody on the line has an interest in it, so thanks for answering that. We've got a question on here about what do we do about Medicaid in Texas. I'm going to take that one. So we've had bills filed for Medicaid expansion every session, like since forever. Unless somebody knows something different than I do, they're not going anywhere this session either. To me, the biggest issue that we're facing about Medicaid right now is whether the cuts that the federal government intends to make as part of its budget to cut $880 billion is going to impact Medicaid. And if that happens, then we are going to, forget Medicaid expansion. We're going to be farther behind than we already are. You can find an excellent discussion by another panel on the Baker Institute website about the threats to Medicaid cuts, and I would highly recommend it. We had some great people addressing that topic from a variety of perspectives. We've got a couple of more minutes. If anyone's got a question, now is your time. Let me go around to each panelist one more time and let's take like 1 minute. What is the one thing that you want our audience to take away from what they've heard today from your perspective? I'm going to call on you the way I see you in little boxes. Esmel Porsa first.
Sure. This is not an issue that is impacting only the indigent. This is an issue for all of us. 100% of the population is going to be impacted by this, no question.
Ken.
Boy, I have too many. So the one I would pick is that this is should not be a Republican Democrat issue. There are many, many people that are going to be impacted that support Republicans and voted for Republicans as well as Democrats. And so this is should be good common sense that we need to keep people covered.
I would say that this is not an existential threat, that it's a clear and present danger, and timing is everything. And if we don't get this fixed, it is going to cause significant harm across the board.
John.
Yeah, I agree with Tom, and to kind of steal Jamie's thunder, I mean, these are people who are doing the right thing, right? They're seeking to get coverage in the private market so they get a medical home, don't have to show up in a hospital ER. And so we figured out a way to kind of hit a sweet spot there. We ought to not screw it up.
Stacy.
So the discussion on this is happening up in DC, right? So it feels somewhat removed, but I think it's just important to keep in mind that Texas and Texans have so much at stake in this debate, and that in some questions about healthcare, the policies are really complicated. And in this one, the fix is pretty straightforward. And so we just need Congress that's trying to do a lot of things at once to really focus in and make sure they get this one thing done too.
Jamie.
Well, I guess to add a last point, Texas is a thriving small employer state, and this is how their employees get their health coverage. And it's the only way it's going to stay affordable for them. So you're really talking about hurting small employers and their employees if we can't find a way to keep health insurance affordable for them. And that's it makes a huge difference for the Texas economy.
We have one last question, and it's from Lynn at Every Texan, and she wants to know what we all should be doing about this. She says we can call our reps and senators and advocate for extension. Are there working groups, or is there someone coordinating strategy among stakeholders, community leaders, and community members? Besides our little group sitting here, how do we identify people, businesses, and organizations that can make the case better sometimes than those of us in the sector can, and bring on board more Republicans? That's a lot of questions packed in there. Anybody want to take a shot?
Well, I'm part of several of those groups, I will admit. So, as Lynn knows, and there is a group of Cover Texas Now coalition that Every Texan supports, and that does and is talking about this issue along with other things to make sure that we keep people covered. There is a national group that we're connected to that I'm now going to forget the name of, but it's somebody remember what? Keep Americans Covered. Thank you very much. Keep Americans Covered. They have a really great website. They have a lot of good information there, and they are working with a lot of different constituents to drive this. But it really, it's interesting to me. It comes down to Texas and Florida are going to drive this decision. And I just don't think enough people in Texas yet understand and know the issue. And so the most important thing that we all can do is just to make sure that our friends and neighbors and family know about this and can advocate for us all.
Yeah, and I would add Jamie and Dr. Porce and I are on the Texas Association of Business Board, and we've added this to the TAB federal agenda as well. So that helps with the business interface.
That's great. We're right at 3:01. I know we'd scheduled a little longer, but I don't see any other questions, and everyone's gotten their last word in. Thank you to everyone, particularly our panelists, but also to everyone who has been part of this today. You have a bunch of experts here. You should feel free to reach out to any of them for more information or clarification on anything they've said. Look forward to seeing you on another webinar or an in-person event soon. Thank you so much, everyone.